Hi, let's go.
Alright, let's take a look at our weather forecast today.
Today's forecast, a lot of sunshine, blue skies, marine clouds. Just a perfect day to go outside and relax. That's your forecast. We'll be right back.
Yeah, sunny days, sunny days, sunny days.
Hi everybody, Dr. Anjanavada here and welcome back to my YouTube channel. Today we're doing another Spill the Tea session with our beautiful Michelle and Bev, and they are going to be asking me all your burning questions that you have sent through from our little Spill the Tea cup, and it's no holds barred, so whatever you want to ask, you ask. Just drop them in the comments down below. Give us a call or send us a WhatsApp.
I have an appointment with another doctor. Is she good at what they do?
Okay, so that's a tough one, right? So people sometimes message me on Instagram or they even phone Bev. Does Dr. Bana know XYZ? Do you think they're good at what they do? So I ethically, I can't comment on such, you have to go see and consult whoever you need to go see, and get a feel for them, and build your own trust relationship and what your goals are and what your treatment planning is. And so also, like, we ethically and also like professionally, we can't really badmouth anyone, in terms of if people are worried about complications, side effects, things like that. That can happen with any doctor, as experienced as they are, whatever type they are. So that is a possibility. As a patient, it is your duty to consult with the doctor and see if that is the doctor for you. So I can't tell you, yes, that person's good. Even though I know they're experienced, they're ethical, they probably would do a good job, but you have to decide yourself on these treatments. Are they suitable for you with their informed consent and with their experience and their bedside manner and whatever elements that go into it? Are they the doctor for you? Often though, like we in Johannesburg, so I used to go to Durban, but we do get a lot of patients from Durban that DM and ask, sorry doc, can you recommend someone in Durban that does what you do? Yes, I do have some colleagues there, so we can recommend a number of them, and from them you don't ask me who's the best. They're all good, and I trust them, so that's why I give them your names. And sometimes when people come in here and we have to refer a patient out, especially for surgery, so to other like to plastic surgeons or oculoplastic surgeons, so we have people we trust that we refer to, and we do trust them. So like by me just referring, like officially referring with a letter, that shows some sort of trust. But we can't off the bat just like randomly tell you, I'm going here, am I doing the right thing? You'd have to decide when you get there. Yeah. And then there's some more questions. Okay, babes, or beeves, as my son calls it.
Oh, okay. I'm going to spill my tea.
Please do.
Okay, the question is, how many treatments will I need to get final results and improvement in my skin?
Okay, so that is a good and bad question. It's bad. It's good because I can tell you why it's bad. So it's a bad question because it's very non-specific. So we do get a lot of non-specific questions here. So if you want something or want to know something about your skin or your treatments, be as specific as you can when you send questions to any aesthetic practice. The answer is it depends. So it depends on me, it depends on you as the patient, on your holistic lifestyle. Are you a smoker? Are you healthy? Do you sleep enough? Are you going to walk the journey? Because if we just do toxin now and then, you're not going to get those results that you desire, those long-term sustainable results. A lot goes into looking good. And I know I actually did an Instagram post on that, that Britney song, you have to work be. Yeah, so you have to work if you want that Lamborghini and that hot
Yeah.
body and whatever else. The same thing with your skin and all of that. And then the thing is final results. Depends. So it depends, like, say you just have a frown. It's your first time, you're young, you don't have any major issues, you frown a little bit. So some botulinum toxin will do great for you. And then your final result will be in 2 weeks' time. You look fantastic. But if you have a lot of skin damage, a lot of laxity, a lot of volume loss, you might need to do it in stages. Like we treat your skin, we treat your volume loss with fillers, and your final result might come, in 6 months, in a year, and then you, at that end of the year, you look different from when you started, but that has to be maintained. So I don't know if there'll ever be a final result, to be honest, but it really does depend. But I always say any little thing you do or any little start to your journey, even if it's starting to wear sunscreen, makes a bit of a change and makes an improvement. So if you want to start small and build up to that. Oh, thanks. Okay, Michelle, what? Later. No. No, it sounds silly.
But I love
Michelle,
Okay.
no holds barred.
The next question is, why do I need to book a checkup after treatments?
Well, it's for my peace of mind, your peace of mind as well. So traditionally we book a checkup after 2 weeks for most treatments, and it's just to see, do you need a little bit of a treatment? Do you look okay? Aesthetically, are your goals met? Is there any complication that you may not say anything about? Like people might be like, leave it, it's fine, it'll sort itself out. But we actually want to check if everything has gone according to plan. Are you happy with the treatment? And is there any sort of treatment that we need to make with treatments? And often at checkups, patients also have like questions and more questions. Is it normal? When must I come in? And you need constant reminders. Like I do this every day. I like live and breathe it. And I was telling someone, we are all about, we must annulate the needle must be this size. And if you listen to aesthetic doctors, we're like a bunch of nerds on and on about the size of the syringe and the extrusion, blah, 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 blah. Patients do not care about that stuff, right? At all. They're just like, how much is it? Is it sore? How long is it going to last? And if they've been for their toxin and filler treatments for the last 10 years, they will still ask you, can I please wear makeup? Can I touch it? Can I go to the sauna? Can I go for a ride? Can I sleep? Can I go sleep? How long is it again? When can I go to sleep again?
And then you count the hours.
So it's a nice way to touch base and check on patients, because we do need to see also how you look after the treatment, and was it ideal? Was it And if there is any changes, it's like, okay, this was done. Let's look forward to doing X, Y, Z as well. Thanks, Michelle. And maybe there's a last question for me.
And my last question is, how soon can I apply makeup after treatment?
We get this every day. Every day, and like I said, it doesn't matter how often the patient has done an aesthetic treatment, they will still ask this. And it's I would actually prefer you ask if you're uncertain. So the next day, even with a peel or microneedling, you think it's superficial, but we're creating an injury onto your skin, we're making it more sensitive. With botulinum toxin and fillers, and biostimulators, threads, and all of that, it's even worse. It's like these needle incisions, and that's like an entry point for bacteria. And our makeup brushes, not everyone washes it every week, and also it gets stuck in there, so it's important to let yourself heal, and then the next day should be safe for makeup. But I know, like, if you had to really push it, say you come for a chemical peel in the morning and you've got a dinner in the evening, okay, yes, but for nothing else. And they do have, they've got medical makeup, oxygenetics or color science. I'm still a bit iffy about applying makeup straight after treatment. There's no need to. There's really no need. Yeah. Thanks. Thank you, Bev. And thank you guys. And thanks for sticking around. We really, really, really enjoyed having you. If you have any questions, once again, drop them in the comments down below, or WhatsApp Bev endlessly. She'll send them to me as well, and she'll answer them. Phone her, DM us. But yes, if you have questions, I'd rather you ask them, even if they seem silly. We love answering questions. And like, share, and subscribe. Thanks again, guys. Bye.
Okay.